Welcome to our discussion about wildfire smoke and health. Living on the west coast of Canada, on an island just north of Seattle, it should be the picture of fresh air, and it is, mostly, until there's a fire. And not even a fire nearby. The smoke travels an incredible distance, as you can see from this fire and smoke map that we at Plume Labs put together with the Western Fire Chiefs Association. But seeing the smoke on a map, it's one thing. But when I see it in my yard, where animals were actually sheltering, this was another thing entirely. You can actually see the ash in the air. And this experience, it got me thinking about some important issues, particularly health. I have three experts here to help us get a handle on what's actually going on when fire smoke blankets a city or town, like you just saw in my video. Not only in terms of how the smoke ends up in my backyard, but also the health impact of breathing it in and the related research going on behind the scenes. My colleague, Boris Quennehen, he's our leading atmospheric scientist at Plume Labs, and he also happens to be an expert in pollution transportation. Welcome, Boris. Christa Hasenkopf, Director of Air Quality Life Index and Air Quality Programs at the University of Chicago's EPIC Lab. Welcome, Christa. And Trang, VoPham, Assistant Professor at the Epidemiology Program at the Public Health Sciences Division at Hutch and Cancer Center. To get started, I'd like to call on Boris to explain a bit about wildfire smoke and how it gets around.
Thank you, Tyler. So today I will briefly introduce the smoke composition and then discuss how smoke can be transported in the atmosphere and how it can be observed and measured. I will finish my presentation with a concrete example of smoke's impact on urbanized areas. So first of all, let me quickly define smoke and its composition. So smoke is a byproduct of the combustion of any fuel available at the wildfire location, and its physical and chemical composition and properties are directly related to the nature of the fuel. Smoke composition can be separated in two categories: gaseous and particulate compounds. The main gases you can find in smoke are carbon monoxide, carbon dioxide, nitrogen oxides, and volatile organic compounds, which include polycyclic aromatic hydrocarbons, which are known carcinogens. If we now look at the particulate matter, it corresponds to tiny particles with diameter in the nanometric to micrometric ranges. They are produced by either chemical reactions within group gases or mechanical processes like the incomplete combustion of a fuel in the case of a wildfire. They are classified in three major classes based on their diameter. So the ultrafine particles with diameter below 100 nanometer, PM2.5 and PM10 with diameter below 2.5 and 10 micrometer respectively. PM2.5 and PM10 are the most common categories in the scientific literature, mostly because they are defined in the national and international air quality standards. Ultrafine particles have been the subject of recent efforts by the scientific community because of their potential impact on human health, but are so far not routinely measured at a large scale. So because of their size, particles can penetrate deep into the lung and even pass into the blood system for the smaller ones. When the particles have reached these parts of the human body, they can significantly affect human health by triggering stroke, heart attack, and respiratory disease, like asthma, for instance. This is just a list of potential short-term affection, but long-term and chronic disease are also associated with long-term exposure to particulate matter. The particulate matter's classification and standard are so far uniquely based on the size of the particles, but recent literature has shown that depending on their chemical composition, particles with similar sizes may have different impacts on human health, some chemicals being more reactive than others with the human body. And this is the case of soot, which is a major component of wildfire smoke that has been identified as one of the most reactive particulate compounds. The impact of smoke on human health is dramatic, and it is amplified by the ability of the smoke to be transported on large distances. and thus potentially impact a very large number of people. The meteorological context is the key driver of such a transport, and if the meteorological conditions are favorable, smoke can travel across continents. You can clearly see that on the left side of the current slide, which shows satellite observations from the MODIS instrument over the US on the 16th of August 2021, when a large part of the US was covered by smoke emitted by a set of western wildfires. Cross-continental transport of wildfire smoke has been documented not only over the US, but also in an important variety of locations, for instance, from Africa to South America or from Siberia to the Arctic. As I just mentioned, satellites are amazing tools to early detect and track wildfires and smoke, especially in remote areas where the EPA monitoring station network is very sparse. But it's not easy to derive the vertical location of the smoke from satellite observations because there is no vertical information associated with them. This means that from an operational perspective, we can't rely on satellites only to issue alerts to the public, because we can't be sure that the smoke observed over a given location is flying close to the ground or at higher altitudes. One additional input that can help tracking wildfire smoke dispersion, especially on the vertical scale, is model forecasts. The map on the right side of the slide presents the smoke forecast from Norway on the same date, but at the ground level only. So this is more convenient to estimate the impact on people's health. And as an example, you can see on the map that the eastern part of the smoke plume, although visible from space, is not forecasted at the surface by the model. And thus, it's not likely to affect human health or activities anymore. In addition, forecasts are obviously very useful to detect in advance potentially impacted areas and issuing alerts accordingly. And that makes it sound like a perfect solution. So one may ask why smoke forecasts are not more widely used and available to the public. And unfortunately, it is because forecasting the wildfire smoke dispersion is a very complex task, which relies on multiple inputs and cross-disciplinary knowledge. So you first need to detect the location and the intensity of the wildfires with human or satellite observation to make sure the smoke emission injected in the model are well initiated. Then you have to forecast accurately the evolution of the ground of the wildfire at the ground level based on the topography and the type of fuel to estimate the evolution of the smoke emissions with time. And finally, the model should disperse the generated smoke according to the weather conditions. And you need to master each step of this process, which is really, again, cross-disciplinary and thus really complex to build. In addition, this is demanding from a computational standpoint, and important resources are needed that can be afforded by every actor in the industry. So now to illustrate more concretely how transported smoke may impact people, let's have a closer look at the biggest US wildfire of 2022, namely the mosquito fire. On the slide, you can see a map with, in red, the final perimeter of the fire as defined by the National Interagency Fire Center. The dark blue dots are the locations of the EPA monitoring stations installed in the vicinity of the fire. Among other pollutants, these monitoring stations measure the particulate matter concentration that would be the closest proxy to wildfire smoke. And you can see in the boxes the particulate matter concentration for the Sacramento and the Reno metropolitan area. The red curves represent the EPA average concentration as measured by the monitoring stations, and the blue curves stand for the NOAA smoke forecast at the ground level. Please also note the black dashed lines at 50 and 100 AQI, which correspond respectively to the WHO recommendation for daily and hourly exposure. WHO stands for World Health Organization. The Sacramento and Reno metropolitan areas regroup almost 3 million inhabitants, which have been exposed to harmful particulate matter concentrations during several days, according to WHO, as you can see on the plots. It has been demonstrated in the literature that hospital admissions increase during and after a particulate matter pollution episode. And unfortunately, we can guess that this has probably been the case during the mosquito fire in both Sacramento and Reno. That underlines even more the crucial mission of the firefighters and the need for strong and efficient alert systems and education on how to protect against smoke.
Thank you, Boris. A couple things jump out at me right away, and I've got Christa here to pick up the thread right after. And I think there's a nice segue here. It's so, we've been working together at Plume Labs for many years, and wildfires come up often, but more and more often now. And one of the things that I'm grappling with both on a professional and a personal level is this difference between smoke and air quality. And I think you kind of unpack that nicely for us in the altitude issue. There can be smoke and you have these crazy sunsets and sunrises, but you might not actually be breathing that in. So it's this untangling of contextual data. Like, we have smoke here, but maybe the air quality might be different, and vice versa. And if this is some of the complexities that I guess we're going to be grappling with, and we can come back to that in the end in the discussion. But that's a nice transition, I think, over to you, Christa, where you're talking about your work at the Air Quality Life Index. So I'll bring you back in a little bit, Boris, but thanks again. See you soon. And Christa, listen, thanks again for joining us. Like I said, Boris will be back and we can jump back into this. But for now, over to you.
Thanks, Tyler. And hi, everyone. As Tyler mentioned, my name is Christa Hasenkopf, and I'm the AQLI and Air Quality Programs Director at the Energy Policy Institute at the University of Chicago, and excited to talk to you about air quality and wildfires and the impact on life expectancy. Great. So I don't know about you, but when I think about wildfires, I don't immediately think about long-term things like life expectancy. I think about, well, fire and of burn up ground. And when I think of the damage done by wildfires, I think of it as a relatively short-lived thing. For example, here is a picture on the left of a recently burned wildfire. And then only a year later, you see lots of green. Things are looking at a full recovery on the right-hand panel. But we don't often examine the decades-long impacts a wildfire and its smoke can have on the length of a human life. And so that's what I'm going to discuss with you about, using a tool that we developed at the Energy Policy Institute at the University of Chicago called AQLI. Very briefly, our team is led by Dr. Michael Greenstone, an economist at the University of Chicago, and the rest of us are spread out across the world, in the US, in Germany, and in India. And so I'll cover some very quick basics on the background of PM 2.5 and life expectancy. A good chunk of that, I think, you heard from Boris as well. But the meat of the talk will be about how can short-term events like a wildfire influence long-term health metrics like life expectancy, and what can we expect in the future with climate change and the frequency in wildfires changing. So as Boris already covered, particulate matter it's a complex material, but you can also think of it as a very simple thing. It's stuff floating in the air. If you see stuff floating in the air, that's particulate matter. There's really tiny stuff. That's the stuff that's really health harmful, as Boris mentioned. But that's all particulate matter is. And common forms of it that are natural or from dust and volcanoes and bioaerosol. And the type of particulate matter that gets us into trouble is most often, from a health perspective, is most often from combustion sources. So that could be smoke from a cigarette or a car engine or household heating or industrial heating or natural or human-made wildfires. And as Boris also briefly mentioned, the issue with particulate matter is its size, and the smaller the particles, like PM 2.5, or particles that are 2.5 microns in diameter or smaller, the worse it is for your health. So we often think of air pollution as affecting our respiratory system, but truly it affects every part and every organ of the body, from your brain to your reproductive system. It has issues with, causes both morbidity and mortality. And so from work at the University of Chicago, we've looked at the impact of fine particulate matter, so that really small stuff, PM 2.5, on life expectancy across the world, and find that it reduces average life expectancy of people on the globe by more than 2 years. So this is comparable to what you experience, what we know happens from smoking, and is much more than what you find from HIV/AIDS, malaria, and war combined. So fine particulate matter, PM 2.5, truly is one of the largest public health threats of our times in terms of the impact it has on human life expectancy on the planet. And so now to that relationship between short-term event, like say a week-long or 2-week-long wildfire, and our life expectancy. So to explore this, we have a portal online at AQLI.epic.uchicago.edu, where you can go and explore the relationship between fine particulate matter, PM 2.5, and life expectancy as an estimate across the world. You can scroll country by country or district by district at varying levels. But for here, you can see India. And you can see that the estimated impact on life expectancy in India due to PM 2.5 is 5 years of life expectancy lost, if instead the air quality were as clean as the latest World Health Organization guidelines. And so this estimate is based off of research, as I mentioned, by Michael Greenstone. And the relationship is roughly that for every 10 micrograms per cubic meter of PM 2.5, long-term and sustained exposure, an average population would lose about 1 year of life. So then applying that to wildfires, we find that a population that is repeatedly experiencing, say, a 2-week wildfire and the smoke from that wildfire over an otherwise pristine year, where air quality is meeting those WHO guidelines of 5 micrograms per cubic meter, really clean air. One could lose, just due to the wildfires, if that's sustained year on year, that type of exposure, 1 year of life. And we see this in reality in California recently. So in 2020, there was an extraordinarily bad wildfire season. And we found in Mariposa County, for example, which had bore the brunt of these wildfires, that if residents there were experiencing year on year the same exposure they had that year, folks would lose an estimated 1.7 years of life expectancy due to that PM 2.5 exposure. And we're also seeing from Marshall Shepard at Stanford University how even over the past decade, we've seen an acceleration or an increase in frequency in the number of wildfires. And he estimates that about 30% of the gains we've made through the Clean Air Act and cleaning up our air have been wiped out due to wildfire smoke alone, and also about 27 times more very high pollution PM 2.5 days due to wildfire smoke. And so the question to be asked is, like, what happens next? What can we expect in the future with climate change? And so for that, we can look at this figure from a recent report from UNEP, and this shows the current state of wildfires across the world. And I think one thing to note first is, as a U.S. citizen, I tend to look at the U.S. and I think of wildfires and the news coverage I see there. But looking at the global view, I see across sub-Saharan Africa, and Southeast Asia. There's the wildfires are on an annual average basis much more intense and prevalent, first. And then second, if we look at this report's estimate of how they will increase, whether you look at a high or low emissions scenario for CO2 going towards the end of the century, we see a very similar picture. We see about a 50% increase in wildfire frequency on average across the world by the end of the century. And you see that most prevalent in those wildfire-prone regions across the world. And I think that's a somewhat gloomy picture, I know, but I think on a optimistic look, many of the metrics and impacts around climate change are quite intangible or hard to conceptualize. They're measured in parts per million of CO2 or millimeters of sea level rise, but smoke from wildfires hits a little differently. We can visualize a wildfire, and the smoke from them can take years off of our lives. I think understanding wildfire smoke on human health and how climate change will increase the frequency of those fires can be extra motivation. And as a society, I think we need as much motivation as we can get to put a little pep in our step when it comes to climate action. And with that, thank you, Tyler.
Thank you, Christa. And I have Trang here that I'll pass the mic after this. But when I listened to your presentation, I'm thinking about, who's going to see this information and what types of decisions could be made by having a better understanding of what this, the actual impact is of wildfire smoke. And our partners at the Western Fire Chiefs Association, they're very, they're the ones who are out putting out fires in the Western US, across all the states. And there's some tough decisions to make because, as you say, there's more fires, they're more intense, they're more radical. But our resources for fighting those fires aren't increasing at the same pace. And so decisions have to be made. And so when you have an urban fire, it's a no-brainer. You got to go put it out. But in Alaska, for example, where it's just burning, you don't dedicate the same level of resources to fighting that fire. And then from a forest management perspective, all of that aside, we need to understand the impact that the smoke that comes and sits over British Columbia or Washington State, what's that doing to people's health? So that might actually affect resource management from a fire management perspective too. So yeah, all kinds of crazy ideas. But now I'm going to pass it to Trang. And again, we have a chance to talk about this, to get into, we think of respiratory illness, asthma, all of these things. But what else is going on with our body that those fine particulates getting into our bloodstream, what's that doing to us? And when we get into the deep research on this, how is that used to help build out products and tools like yours? So over to you, Trang.
Thank you. And thanks to Tyler for organizing this, and thanks for the opportunity to speak. So my presentation today will be focused on the potential impacts of wildfire smoke on cancer survival outcomes specifically. Now, as an overview of today's talk, I'll first be describing some relevant background, the study methods, preliminary findings, and then I'll end on a summary of next steps. So for some background, and building on Boris's and Christa's really nice previous presentations, in 2013, the International Agency for Research on Cancer, or IARC, who conducts scientifically rigorous evaluations of environmental factors, classified outdoor air pollution in general and particulate matter, or PM, as group 1 human carcinogens, meaning that there was sufficient evidence of carcinogenicity, in humans. And these IARC designations help to guide scientific and policy decision-making. And in particular, the presentation today will focus on the PM 2.5 size fraction, which, as mentioned previously by the other presenters, can be inhaled deep into the lungs and penetrate the lung barrier and enter the bloodstream. Now, wildfires in particular, these are unplanned fires. They burn in areas like the forest previously mentioned, and they're often caused by humans, or by natural events like lightning. And wildfire smoke, also mentioned previously, can be a really important source of outdoor air pollution. The major air pollutants can include, for example, PM 2.5 and ozone. With the wildfire smoke having the capacity to travel and permeate areas up to 1,000 kilometers away from the actual wildfire event. And importantly, climate change is associated with high temperatures, strong winds, rainfall anomalies, and or lightning strikes, all of which can increase the opportunity for wildfires to occur. So, from my previous slide, we know that air pollution is an IR classified group 1 human carcinogen, meaning that it increases the risk for developing cancer in humans. What about the role of air pollution specifically from wildfires? So there was this cohort study that was published last year. This was a cohort study of 2 million residents in Canada, showing that residing within 20 kilometers or 50 kilometers of any wildfire burned areas was associated with slight increases in the risk for developing lung cancer and also for brain cancer. And now, in a slight pivot to cancer survivorship, there was a nice study published in 2021 looking at PM 2.5 air pollution and mortality among the population of cancer patients. And the authors found that higher ambient PM 2.5 exposure was associated with higher cardiopulmonary mortality observed in all cancer patients, as well as in the 5-year survivor cohort, or among those surviving at least 5 years after cancer diagnosis. Now, in bringing together these different concepts from these two studies, but applying a slightly different research perspective, we conducted a study on wildfires, air pollution, and cancer survival. This was an abstract at the American Society of Preventive Oncology, or ASPO conference this year. And this was conducted in collaboration with Tyler and Boris, and also some of my other wonderful colleagues. And our study objective was to examine the associations between ambient PM 2.5 exposure and wildfire locations in relation to mortality among cancer patients who may be particularly vulnerable to the effects of PM 2.5 due to undergoing cancer treatments, for example. And this work builds on biological plausibility, showing that wildfire or wood smoke derived PM is associated with adverse effects in experimental studies, such as in animal models, through various pathways listed on this slide. And for this study, we examined cancer patients diagnosed from 2000 to 2019 using what's called the Surveillance Epidemiology and End Results, or SEER database. And we included data from 15 population-based cancer registries across the US, consisting of the 604 counties shown on the map to the right. And PM 2.5 and wildfire exposure were estimated based on the SEER county of residence at diagnosis, which was available for each cancer patient. And using also a geospatial science tool called Geographic Information Systems, or GIS, as part of the exposure assessment. And the outcomes that we examined were all-cause and also cause-specific mortality using cause of death data from the National Death Index. And in particular, so to estimate PM 2.5 exposure for the cancer patients in this study, we used a PM 2.5 exposure model already developed by the Environmental Protection Agency, or EPA, that incorporated information from air pollution monitors, for example. And using GIS, this PM 2.5 exposure model was overlaid with the SEER counties of residence at diagnosis to determine PM 2.5 exposure for each cancer patient. And then to estimate wildfire exposures, we used a nationwide geospatial data set from the MTBS, or Monitoring Trends in Burn Severity, which maps burned areas from large-scale fires across the US using information from satellite imagery, for example. And then using GIS, the wildfire exposure data set. This was overlaid, again, with SEER counties to determine wildfire exposure measures for this study. And we examined wildfire exposure defined two different ways. So First, as the number of wildfire events within a county, and then second, as the percentage of the area within a county that was burned by wildfires. And for this second percentage area metric, as you can imagine, we ran into multiple instances where the perimeter of one wildfire event would overlap with other unique wildfire events. So we were able to address this by using a GIS tool called Dissolve to essentially dissolve all intersecting wildfires to appropriately examine them as a single wildfire burned area in a given year for a given county. And for the results, so over 6 million cancer patients were included in our analysis. We examined risk for all-cause mortality and also mortality according to cardiopulmonary cancer and also other causes. And consistent with previous research, we observed generally positive associations between higher ambient PM2.5 exposure and increased risk for mortality among cancer patients, with the strongest, although still modest, association observed for cardiopulmonary mortality, which included causes of death due to heart disease, cerebrovascular disease, or stroke, COPD, pneumonia, or flu. So, for example, I wanted to highlight this result. So this result here means that after adjusting for or accounting for important variables such as age, sex, race, ethnicity, among cancer patients, a 10 microgram per cubic meter increase in ambient PM2.5 exposure was associated with a 5% increase in risk for death from cardiopulmonary causes. Now, next, we thought one way to maybe meaningfully incorporate the wildfire exposure into this analysis was to see if the association between PM2.5 exposure and mortality among cancer patients depended on if they were located in wildfire impacted areas. So here we show effect estimates stratified for PM2.5 and cardiopulmonary mortality stratified by the number of wildfire events occurring within a county, and then also stratified by the percentage of the county's area that was burned by wildfires. And overall, we see some interesting signals. So with stronger positive associations for PM2.5 exposure and cardiopulmonary mortality among cancer patients residing in areas more heavily impacted by wildfires. This is shown in the rightmost results in each panel. And this was also consistent across both wildfire exposure metrics. And this could make sense, perhaps due to differences in chemical composition, where emissions of perhaps specific chemicals from wildfire smoke have relatively higher toxicity. And the impact of this work I wanted to highlight as providing first pass preliminary insights into the potential impacts of wildfires on cancer survival outcomes that we aim to refine in the future. So in summary, we found some preliminary evidence showing that exposure to air pollution in wildfire impacted areas may increase the risk of dying among cancer patients. Some limitations of this work, though, which represent areas for improvement in the future, include how we use the county in particular to determine exposure, which is a bit coarse scale. Strengths, though, of this work include how we were able to examine a large sample size of cancer patients residing across the US. And as for next steps, we are submitting a grant next month, actually, to follow up on these findings using higher resolution locational data. So fingers crossed for a favorable funding outcome for that. And I'd just like to end by thanking my wonderful collaborators. This work would not be possible without them. I'd like to acknowledge the data sources that we used for this study, and I would like to acknowledge funding and support from the NIDDK. And thank you so much for your time.
Thank you, Trang. This is, okay, first of all, it's amazing to have the three of you on a call together. I've wanted to do this. You all kind of hold a piece of the puzzle. And that's the key reason I wanted to get us all together, was the thread that binds here is the data, and whether we have it or not, or can get it, and what creative ways we can work to achieve that information. And that's the fundamental core belief behind Plume Labs, is that if you can measure it, you can tackle it. You know, like suspect, measure, act is kind of like my mantra. And in my experience, just working with people all over the world on the craziest projects, the challenge always comes down to getting the right data. Just like that's the kind of jumping off point if we can build the foundation. And I've come to appreciate over the last year or two working with you and Christa and Boris on topics like this, wildfire smoke, is that it just adds a whole other layer of complexity, because smoke doesn't equal air quality and vice versa. And there's just all this other stuff we have to think about, and it's getting worse and crazier. And with that, I want to bring back Boris and Christa to kind of dig into that topic. I mean, we don't have a ton of time. Welcome back, Ang. I'm sure you heard me talking about the data that brought us together, and the challenge is getting it. And that's where I want to go in our last few minutes together, is to try and, well, first I'll put the question to you, Christa, to start with, and then we can hear from Trang, and then Boris can jump in. But and don't take that as, if something's burning in your head, get it out before it does damage. So correct me if I'm way off, Christa. Getting great data, for sure, something you've come up against as a challenge in your work. And I'm just wondering, have you dealt with this? And what would be the perfect data landscape for it? Obviously, it would be just like everything everywhere all at once, but in the absence of that, within the bounds of reality, how would you go about that?
Yeah, I think often of data anymore, like from my perspective. I think about the intersection of data and honestly resources to get that data, and why there's such a mismatch between when you look across the global air quality data landscape of where there's data and then where there's actually really high levels of pollution, whatever the cause. And I'm always just shocked when I see a yearly report from the Clean Air Fund that looks at the air quality funding landscape. And, this past year, seeing that the entire continent of Africa had a total of $300,000 in global philanthropy from philanthropies and foundations dedicated towards air pollution work. Yet it's a continent where there are countries with no data, and we know no on-the-ground data that's from reference-grade sources in many places, and then also we know from satellite-derived data that clearly there are higher pollution levels. So to me, while that's shocking, I think it's really exciting. Like, to me, that's like there's such an opportunity to make a big dent with not a ton of resources in a lot of places, by like really highlighting to a lot of folks and organizations that there's this huge mismatch. So that's how I've been thinking a lot about the data gap issue lately, and let others chime in.
For sure. Boris, we've done some work in sub-Saharan Africa trying to figure out where, by using machine learning and modeling, to figure out where the right places to invest are, rather than, because there's just a huge lack of sensors on the ground pumping out data. And so if you've only got so much money, where do you invest? So that could be a promising area for models, I think, rather than just taking the data as truth, using it as the first step. Again, that's a sort of suspect, measure, then and invest, maybe. Trying, how do you react to that?
Well, building off what Christa said, like, at least from an epidemiologic research standpoint, we're interested in examining population level exposures, right, and outcomes. And we often have research questions that we want to answer. We design a study, we map out a statistical analysis plan, but often the data that are available that we end up using were not created for the purposes of research. Right. And that's just reality. So maybe it's, a coarse spatial resolution and or temporal resolution. Maybe it was captured at one point in time. That doesn't quite align with the data from our study population of interest. But I guess in particular, we've approached this two different ways. So first, it is our responsibility as researchers to analyze the data and carefully interpret study results while being completely transparent about any limitations and what can actually be inferred given any study limitations in the papers that we publish, the presentations that we give. And then second, the way that we've dealt with this is just to continue advancing the work. For this air pollution, wildfires, and cancer survival analysis that I just presented, it's based on county level locations, right? And we saw some interesting results. And now we're writing a grant to request funds to advance the work and using that data that I presented as preliminary data to justify requesting higher resolution cancer patient street level address data, not just the county, to look at these associations. So that is how we sort of approach it.
Yeah, I like that approach. It's
Me too.
it's how we've been operating to try and again come up with hotspots and use that as an excuse to dig the elbows in to maybe put some low cost sensors in to confirm what we're seeing, and then bring in some reference quality data. And Boris, this is this is your pain, right? This is exactly what you're working on. So it's awesome to have you here because you've been trying to solve for this since the beginning, right? And I mean, I know we don't want to hear your challenges, but we do want to hear your challenges about creating this. So we've seen tons of advancement in technology, NASA, some new satellites up looking at things, but there's limitations that you mentioned. So could you take us through just kind of, what you're seeing on your end as someone trying to fill those data gaps and how we might, go forward?
Yes, sure. So one very promising field is, for me, obviously the low-cost sensors. There exist, for instance, so I think they are mostly distributed in the US, but the Purple Air network, which is now it's now a very dense network, especially in California where the wildfires occurred, and we found that when a wildfire occurs in the area, the sensors were able to accurately observe the very high increase in PM concentrations, and they not only measure the increase in concentration, but they are also very accurate when we have a chance to compare them with a nearby EPA monitoring stations. And to me, the deployment of such low-cost sensors is probably the most promising way to improve the coverage of smoke observation, but not only that, air quality as well. And Christa, you were mentioning Africa, which is really lacking ground-based data, and to me, this is probably the key solution to that issue, because these kind of low-cost sensors are very cheap, and they don't need a lot of maintenance, and they can be very quickly deployed on a wide area. This would also solve your questions, Trang, because you would be able to access much more localized data than what you have today. So to me, that's the perfect solution, because in addition, it can complement the modeling framework we are building at Plume Labs. Because yes, obviously our goal is to have the highest resolution possible, but our main limitation is the amount of monitoring station available in given location. This is why we are able to monitor, for instance, to model air quality at the street level, but only in large urbanized area, because there is a lot of monitoring sensors available, and not in remote area where the density of monitoring stations is much more sparse. So yeah, this is for me the main solution to our problem. And so the popular sensors I was mentioning are static sensors, so they need to be installed. They need to be plugged to an electrical sources, but there exist also mobile sensor that can be handled by the users to monitor their exposure. We have been quite a lot of work on that field with the flow sensor, and that's for me a key solution as well. Probably more related to epidemiologic studies, because you can really have a clear understanding of the exposure of the person you want to analyze.
That's a key point too, because when we're talking about measuring in satellites, we're looking at the air quality outside. And that's not necessarily what people are breathing, because we're interesting organisms. We move all over the place. We go way up in the air and underground and inside, and there's all kinds of other factors, I guess, that affect what we're breathing, where we are. And so, yeah, it's challenging to be able to get a full picture of what a human is breathing all the time. And that's, mobile sensors, wearable sensors. There's I think for longitudinal exposure studies, to get from that, like, just describing what's going on to actually prescribing an intervention, that's when you have to really drill down to the individual level. So we didn't really touch on the indoor air quality aspect of a smoke event, what happens. And I found myself, duct taping furnace filters to fans, right? Like during smoke events, all kinds of things that are doable from an individual level if you know what's going on. So I think knowing what's happening outdoors will actually help people prepare. If you know 2 days in advance there's smoke coming, go to the hardware store, get a filter, prepare yourself, cancel the soccer game, all of these things. There's stuff we can do. It's not, it's fiddling about the edges with the big problem, but it's still reducing our exposure at an individual level. That's a whole other conversation to have. I'll start figuring out who to bring in for that one, because that's, now that we've got a foundation, where do we go from here as individuals, as businesses, as governments, regulators, planners, forestry professionals? There's all these people can use the information we're putting out there, but it's kind of packaging it in the right way to make it approachable and useful and actionable. So with that, do any of you have anything you really want to get off your chest, last words, before we wrap up here? Okay, I'm going to take your silence as tacit approval to close out, and thank you again for everything, all your work, for the collaborations, the good times, and for coming today. I really appreciate it, and I'm sure everyone who watches this does as well.
Thank you, Tyler.
Thank you, Tyler.
Thanks.